Good afternoon, everyone. I'm Cameron Friesen, Minister of Health, Seniors and Active Living for the province of Manitoba. I'm here with Dr. Brent Roussin, Manitoba's Chief Provincial Public Health Officer, and we will get right to it. So over to Dr. Roussin.
Thanks, Minister. Good afternoon. The current 5-day test positivity rate is 1.2%. 15 new cases of the virus have been identified today as 9:30 a.m. However, a case was removed as it was determined to be from out of province, and a second case was removed due to duplication. So we have a net increase of 13 cases today, taking our lab confirmed cases to 1,378. 2 of those cases in Interlake Eastern, 2 cases in Prairie Mountain Health, 2 cases in Southern Health, and 9 cases in the Winnipeg Health region. We have 360 active cases, and 1,002 individuals have recovered from COVID-19. We have 11 people in hospital and 3 currently in intensive care, and the number of COVID deaths remains at 16. Our preliminary investigations indicate that several of today's cases are close contacts of known cases, and these investigations will continue. Lab testing numbers show 1,173 tests completed on Wednesday, and bringing our total to 150,350. We have 2 potential exposures to COVID-19. September 1 to September 3 at Lilac Resort, Trans-Canada Highway, St. Anne, and September 5, Air Canada Flight AC295, departing from Winnipeg to Vancouver, rows 19 to 25. Individuals in the affected seats on these flights are advised to self-isolate for 14 days following the flight and monitor for symptoms. Passengers on these flights, but not in those affected rows, should self-monitor for symptoms and self-isolate if any symptoms develop. Late Wednesday, Public Health advised of a positive COVID case at Churchill High School. This is a student that was asymptomatic while attending the school for a limited time on Tuesday, September 8th. This student left midday when the test result had been received. The asymptomatic individuals waiting for testing results are not required to self-isolate. Obviously, transmission was not acquired at school since this was the first day of school. Because of all the other factors in place, physical distancing, mask wearing, both on bus and in school, there were actually no close contacts were identified at this exposure, and so Public Health has not advised anyone related to the school to self-isolate. Therefore, the site is not being elevated according to our pandemic response system due to the lack of close contacts identified. So again, we talk about the importance of stigma and avoiding stigma in a time of pandemic. We know that in this case, this individual did everything that they were supposed to do, and that resulted in no close contacts being identified in this area. The more we scrutinize this situation or try to identify an individual, the less likely it is the next individual who might have mild symptoms will go for testing. So we need to remember that we're all in this together, and we have to have the well-being of Manitoba at our forefront when we think about these things. So please do not try to stigmatize an individual. We want everyone to be able to go for testing, and I would encourage anyone, whether in school or elsewise, go for testing. Even if you have mild symptom, if we identify you as a case, we'll take all these steps needed, but no one blames you for having COVID-19. We just need people to go for testing, so do not be afraid to go for testing. Public Health, we committed to Manitobans that we'd provide detail on all these cases, and so we provided the class and room number. I think it's important to keep Manitobans informed, but we need to balance that with stigmatizing individuals and then deterring others from getting tested as we go along. We knew we would see cases in schools, and we'll see more. But just like this, we have a lot of things in place to limit the ability to transmit that virus in schools. As we indicated previously, the community area data within Winnipeg will be available tomorrow, Friday, September 11th. The city will be divided into 12 community areas. And like the health districts, data will be regarding active and recovered cases, deaths, and total cases will be available. This will be available on our website, manitoba.ca/COVID-19. Wearing a non-medical mask became mandatory for children aged 9 and older attending childcare facilities. This includes home-based childcare as of September 8th. Childcare providers are also required to wear masks, and more information and guidance for early childcare sector is available on the manitoba.ca website or under families. There will be some exceptions to this. Like we said, not all Manitobans are able to wear masks. Parents will be reminded of these rules and asked to be sure they have a mask in the future. We talk about the fundamentals, and we know the importance of that. Manitobans are well versed in that. Washing our hands frequently, physical distancing outside of the house, staying home when you're ill, and wearing a mask in indoor public places is an added precaution that we can take. We've mentioned again, employers want to encourage employers to lift barriers for people to stay home while they're ill. We discourage Manitobans who do not have symptoms, who have not been advised to go for testing, to not be tested. And one last word again on the stigma, that we are in this together, and stigma has real negative effects on not only the individual that's stigmatized, but on our ability to manage this pandemic, as it will discourage people from going for testing in the future. So thanks for that, and I can open it for questions.
The student, I know you're very wary of the possibility of people being stigmatized, but I think there are some legitimate questions of public interest here. If the student received their test results and then left school, the student had obviously gone for testing while asymptomatic. Can you explain what prompted the student to go for testing while asymptomatic and then attend school?
Yeah, all I can say is that it was asymptomatic testing. Was not advised by public health to go for testing, did not go for testing because they were a contact of a known case. And so if you did the online screening tool, that wouldn't have screened the person out.
So this person was not a close contact of a known case?
That's
right.
right.
You consider this community spread incident?
Well, you know, like when we look back, we'll do the case investigation, but certainly they did not attend testing because they were a contact to a known case. They were asymptomatic at the time. They weren't advised to go for testing. They weren't advised to self-isolate. So, you know, everything was done right at this point.
You said asymptomatic people don't need to isolate while they're waiting tests. Is that something that maybe you're looking at changing?
Well, we're discouraging asymptomatic testing for the most part. But when we think about the various things that we can advise to self-isolate, certainly people who are contacts to cases, they have to self-isolate for the 14 days. Right now, people who are contact to just people at home who are ill, we're not advising self-isolation. We are advising that everyone get tested. But as we move into fall and respiratory virus season, if we advise people who have say ill people at home and that whole household to self-isolate, we're not going to have many people at work or at school. So we have to find that balance.
But if you're waiting for a test result, would that make more common sense to wait until you have a positive or negative result?
If you're asymptomatic, right? Like you know, I'm asymptomatic and I came to work today, and if I went for a test yesterday, it doesn't put me at less or more of a risk of having COVID. So just being asymptomatic and you happen to go for testing, we don't advise to self-isolate.
But it would put others at risk, would it not?
It doesn't put others at more risk, right? Like I'm asymptomatic. If I showed up today, whether I had a test yesterday or not, I'm in the same risk category, right?
So was this asymptomatic or pre-symptomatic? Because sometimes you use those terms interchangeably.
Yeah. So If asymptomatic is just without symptoms, so it was without symptoms, and later on, if this person developed symptoms, then we would say it was
So
pre-symptomatic.
to be
So,
clear, this student still has no symptoms to your knowledge?
yeah, at the last I've heard, no.
And you compile this info for the daily briefing every day at 9:30. Why did this info not come out at 1 o'clock yesterday as opposed to the 5:45? And then the corollary to that is, how come this preceded the division release, the school release of the info?
Yeah, so, I think that we had a lot of things in place to be able to respond to this. We knew we were going to see cases. So, I think that our goal would have been to have it out earlier. But we were able to get it out that time. We wanted to get it out at the same time as the division to get that information out, so.
And when was the student actually tested?
Yeah, we're not gonna release the specifics on the
Prior to
individual.
Tuesday?
Prior to.
Can you say how long it took for the student to receive their results after being tested? Was it?
Well, that would indicate when they went testing, yeah. So, as soon as public health was notified of the result, there certainly wasn't any significant delay in having the person leave school.
Dr. Roussin, are you going to be providing this level of detail about students as cases are found in schools, like grade 7, room 20, Churchill? Is that what we're going to expect from now
I think
on?
what we want to do is describe the cohort. So we want to be able to describe the cohort. So there might be, in some schools, it would be grade 7, cohort 1 or something, but just however they describe the cohort, we don't want to say a case just in, say, Churchill High School and leave everyone out wondering which cohort it was in. So we committed to provide that information to Manitobans, and so I think we'll continue to.
I'm appreciative of the detail here, but I'm wondering what the thinking is that you provide this kind of detail in this case, but the province is very hesitant to use the word Hutterite or Maple Leaf Foods. Maple Leaf Foods is never uttered. Why? Can you describe or explain why in one case and why not in another?
Yeah, well, I mean, I think this is a commitment we made when we started to get to the plans to have kids back in school safely. There's a lot of questions about, about those plans and what things were in place for it. And it was very important to be able to get the kids back to in-class learning. And so part of that plan included that commitment that we would keep Manitobans specifically informed of where cases were.
I think for both of you, have you heard of any issues with possible language barriers posing an issue when people get tested, being told to self-isolate, and not that they're not following the rules, but maybe aren't understanding some of the rules in some of these cases as well?
That is an issue, and we've addressed it, along the way in the pandemic with the information that's been translated in many different languages. But it certainly is an issue.
Just in terms of you've spoken already about the stigma, and what, given that high school students are stressed out enough about going back to school even before the pandemic and are during the pandemic, what would you have to say about the mental health effects on this particular case, given the intense scrutiny?
That's the downside of releasing specific information. And so I think that we've made it clear, and I'm being certainly forthcoming, is that everything in this situation was done correctly. There wasn't anything that this individual did wrong. And so I would encourage people to accept that and then recognize that there is that importance for this individual. That's the most important thing. But it's also important for the next individual who has, say, mild symptoms, who's going to think twice about going testing because of the level of scrutiny.
How do we know the mask protocol was followed for the entire time?
Well, most of our case investigations will include speaking with the case themselves and look at the information they're providing. In these type of instances, we have other type of input from the school too.
And in this case, the school engaged in electrostatic, aerosolized, disinfected cleaning. All the research literature that we've heard in the last few months say that that is no replacement for wiping down. But how effective is electrostatic aerosol fogging, or whatever you want to call it, in addition to other cleaning in terms of disinfecting things like the courthouse, schools, buses?
Yeah, I think it's important what you said there is that we have to rely on the acceptable disinfection right now, wiping down the surfaces with an appropriate thing. That may add some benefit. I think the evidence is still out on that. But if we are adhering to the normal protocols, this is good, and then this may add a additional benefit.
Well, this is important. These machines are expensive. They're like 20 grand. Are you recommending businesses, public institutions go out and purchase electrostatic aerosol fogging machines?
At this point, no, that's not part of the public health recommendation. But as you know, there's, evidence grows every day, and that could change.
Dr. Roussin, has not been your recommendation for asymptomatic people to get tested. It was obviously helpful in a situation like this where it found a case. Is that going to be moving forward something that you should be seeing more of, people going and getting tested when they're asymptomatic?
No, I think we would still not encourage asymptomatic people to get tested. You're going to find these sort of anecdotal ones where it may have provided benefit. But for this to really work, you'd have to be doing routine asymptomatic testing on a large scale, right? And it's just not feasible to do that.
Dr. Roussin, do you know of school-age siblings of the child that tested positive at Churchill being in school?
I'm not aware of their family situation. I don't know if they have.
A younger sibling that may have gone to school today. Would they normally be required to stay at home?
If they were a household contact of a case, they should be self-isolating. I don't know the facts of this person.
There were 13 students in the classroom, or 13 other students. Obviously, the release stated yesterday, no close contacts. What parents are going to ask, what should any of those students do, if anything, at this point?
Yeah, I would put them in the same category as other Manitobans. Monitor closely for symptoms, stay home if they develop, get tested.
If we're going to see breakdowns in terms of areas in Winnipeg, will we see breakdowns for school divisions as cases start to rise?
Well, we're going to inform of cases connected to schools. And if required, if there's multiple contacts within a school, then we'll be listing that on the pandemic response system. But we'll just be breaking down the cases through the community areas.
We've asked you before, but what's your messaging to parents and other students right now, particularly at that school who may have a little more anxiety today, a little bit more fearful? What do you say to those people now to help alleviate that?
Yeah, I'd say that we expected to see a case in schools, and we can be certain that this case wasn't acquired within the school. So we certainly haven't seen a case that's been acquired in the school with our protection, and it's sure possible we will too. But I think we're living with this virus, and kids have had COVID throughout this pandemic, and they'll continue to have it. But we got to find ways to limit the transmission.
Winnipeg is up to 163 active cases. To what extent, what percentage of those cases are community transmission at this point?
I just have the last 7 days in WRHA. We have 22 non-EpiLink cases as of right now.
Out of,
I don't have sort of the numbers. So the active cases are over 10 days, and so this is over the last
you're
7
going to
days.
make us do math
Yes.
here, and that's fine for Mike, but, so I'm going to assume then that that's above 20% then? Just off the top of my head.
It's around that 20%.
Dr. Roussin, do you have further information on outbreaks at personal care homes? How many, are there been any added numbers? For instance, Bethesda, Brandon Regional Health Center, well, it's a hospital, but Fairview, et cetera, do you have?
That's right, yeah, since our last update, there's no
No
additional
additional cases at any of these?
At any of them.
Okay, thank you.
And on that note, since the report that I asked you folks about on Tuesday, that was published on September 2nd, what it did not say is where the HSC outbreak began. We knew that there was one patient that was in there for a while that suddenly was tested positive. Did the investigation into that outbreak ever determine the source or sources of that outbreak, to your knowledge?
I don't think we came down to a specific source. I think there was a number of those cases were diagnosed right around the same time within the same incubation period, so it's tough to locate what the source was.
I know we're dealing with back to school. Something else we've been getting questions on, because we've seen some public health officials talk about it in other provinces, is Halloween, and what your recommendations are for trick-or-treating, what you're gonna say to kids. I know this can all change because it is still early in September. Is it safe for people to do that where we are right now?
Wear a mask.
So, yeah, I mean, I think it's a little bit early. I don't really want to give a recommendation on that yet. I mean, I think we have to be prepared to, just like we've all been doing, is to change what we normally do. So I doubt Halloween's going to look like it normally does, but you know, it's a little early. I don't have a specific recommendation yet.
Are you, has the look of this pandemic changed in terms of transmission? I know you've talked about 20% community transmission in Winnipeg. Lately, that's inched a little bit higher, but people have wondered, you know, is this spreading through mass gatherings? Is it spreading in the workplace? Is it spreading mostly among home and household contacts? What has the shape of this thing shifted recently?
It hasn't really changed recently. I think that, you know, even in the first and second waves, if we call it, we're looking at our secondary attack rate is still at 14%. So 14% of people who are named close contacts of a known case go on to develop COVID. We know that in Prairie Mountain Health, one of the reasons why we went to orange and had the gathering level restricted was that we were seeing transmission in large gatherings there. That was what was driving the outbreak there. In Winnipeg, it's you know, most of the driving force is household contact and contact between households in communities, and so you know.
When you say contact between households, that's people enlarging their bubble in essence, having contact.
Yes, yeah, families, multiple families and things. So we'll see that, and then of course we always had that non-epi-link cases, the transmission that way. So much of the transmission dynamics are staying consistent.
Does the province have any plans to fast-track school testing in any way, or get the results back from any tests done at school?
Yes, we don't have immediate plans with that. We're certainly planning on, you know, with tests of school-age children or tests of on the requisition that indicate they're working in the education sector. Then we're certainly looking at that data closely. But right now, the way that we set things up at the lab, we don't have much of ability to prioritize large groups like that to speed up. We are working on our turnaround time, and turnaround times have still at the lab have still been that 24 to 48 hours, and you know, often on the short end of that.
Dr. Roussin, do you know if the 5 school-aged cases today are in school or not?
Yeah, so not to my knowledge. So there was one school-aged child reported from Prairie Mountain Health, and that was actually one that was previously reported. That was early August, so already done the incubation period. The ones that were reported out in Winnipeg have no feedback that they are in school or have been at school.
Sorry, you said Prairie Mountain?
I believe there was one in Prairie Mountain.
My math
Okay.
shows 1 at Southern Health and 4 in Winnipeg.
Okay, so yeah, so one of the cases was actually an older case with it. So, but yeah, no, I'm not aware of any other classes involved.
Thank you, Doctor. We're going to take a few questions off the phone now. First to City News and Stephanie.
Heather Stephanie with City News. Dr. Roussin, you said it was kind of necessary for employers to lift barriers for their employees to be able to stay home when they're sick. Minister Friesen, I'm just wondering where the province is at with the paid sick leave program.
Well, we continue to call on the federal government to, continue to make sure that program is there for those who need it. Our government has been very generous to workers as well, and of course, it was early on in the pandemic that we indicated very clearly that if people sent home from the healthcare sector to stay at home would be compensated. So there's been progress the whole way along. Clearly, probably more work to do.
And then just a quick follow-up on this electrostatic fogging. I know we spoke about it a bit earlier, but Dr. Roussin, can you just give people an overview of what this is and what we know about it so far?
Yeah, well, oh, sorry, I don't have a lot of evidence review on this. This is just a, just another mode to, thought to kill the virus or limit the virus's ability to spread. So the evidence is still out on that. I think the disinfection of regularly touched surfaces, hand washing is very important. And over time, we may find that these are also beneficial, but we're still out on that evidence-wise.
From the Brandon Sun, Emily.
Hi there. Can you hear me okay?
Yes.
Okay, yeah. Hi, Emily Klatt from the Brandon Sun. So my question is for Dr. Roussin. And so Prairie Mountain Health, the region has reported very low numbers of new cases over the past 3 days. And I'm wondering when can people expect the level orange restricted status to be lifted, or if there's any time estimate?
Right, yeah, and so we did see, we're seeing some early trends in Prairie Mountain Health that those numbers are improving, so it is early. We're still just outside of the first incubation period since we put that restriction on, so we're going to watch that closely. If we continue to see those trends moving that way for the next week, then we'll certainly have very close eyes on when we can lift that restriction.
So just a clarification on that then. You don't have a time estimate for when the status orange may be lifted?
That's right. Yeah, we can't provide a specific one because it's going to depend on the numbers that we see. So we'd really like to see a trend going for at least an incubation period. So we're still early on that, but we'll be watching it closely.
From CJOB, Will.
Good afternoon, everybody. My name is Will. I'm with CJOB. Dr. Roussin, I was reading this morning that outbreaks have been declared at 2 Alberta high schools because they found 2 or more cases there. 2 cases seems like a pretty low threshold to declare an outbreak. So I'm wondering, do we have similar thresholds here, or what are ours?
Yeah, if we find any transmission within a cohort in a school, that will be an outbreak to us, and that would require us to lift the pandemic response system for at least that cohort. You may notice in our personal care homes, we just declare an outbreak with a single case. So just it depends on the risk scenario.
Okay, thank you for that. Also, in BC this week, they upped some of the restrictions, tighter restrictions on nightclubs, bars, across the pond in England, also limiting gathering sizes. This is ahead of fall, the logic being that as the temperature dips down, they have less opportunities to socialize outside. There's going to be more of that moving indoors. Would we see similar movements here, or not quite yet?
Yeah, and so this is our, purpose of our pandemic response system, to be able to take that targeted approach. So in those places, their epidemiology led them to see that transmission was occurring in those areas, and so they acted in that regard. And so similar to what we saw in Prairie Mountain Health, large gatherings was driving the epidemiology there, so we restricted those. We'll continue to watch, and if we see evidence that's affecting a region or affecting a sector, then we'll respond in that fashion.
From the Winnipeg Sun, Scott.
Good afternoon, Dr. Roussin. Scott Billick, Winnipeg Sun. So trying to wrap my head around this asymptomatic case, or the student. When the province has talked about out of abundance of caution all the time, why even when a person does get an asymptomatic test, why wouldn't they be required to at least stay home until they get the results of their test? Like, why is that just not a requirement, given what we do know and what the research does say about asymptomatic spread?
Yeah, well, I mean, I think it's just a level of risk, right? So like I gave the example is I'm asymptomatic yesterday and today, and I'm at work today. If I had a test yesterday, that doesn't mean I'm somehow more at risk than I was if I didn't have a test yesterday, right? So we don't require asymptomatic people to self-isolate unless they're a known contact to a case.
Right. Yeah, and so I'll follow up on that. But why not just reduce the risk by saying that, if testing gets back to people within 24 to 48 hours or even up to 5 days or whatever it is, why not just require those people? I mean, it just reduces the risk. It would seem to me that it would just reduce the risk of having someone spread it until they find out that they are positive or negative.
Yeah, well, it would certainly reduce the amount of people going for asymptomatic testing, but I don't think it reduces a risk because people who went for asymptomatic testing aren't more at risk of having it than a person who didn't go for testing. So if that person didn't go for testing, they would still be at school today and tomorrow and the next day. So it doesn't decrease the risk.
From CBC Radio Canada, Gavin.
Hi, this might be a question for the minister. In Alberta, they've come up with a sort of mapping of COVID cases in schools. Is Manitoba considering some sort of mapping system on your website or whatever to show COVID cases in schools?
Well, thank you for the question. This is what we can say, that we are very specifically now identifying cases, as you know, where they occur through a district-based reporting system. With the addition of Winnipeg tomorrow on the first day, it'll bring the number of individual districts we're reporting to 79, which is considerable. The pandemic response system, as Dr. Roussin has said, is a significant framework in which we can report. If you're asking whether we will individually and with more specificity then report on schools in there, I think we'll have to wait and see what the future holds. The school has just been starting this week. We can roll up those numbers and report them by those 79 districts. As we continue to go along this path, we'll watch to see what the data is showing, and we're not against making other changes in the interest of good disclosure.
Question for you, Dr. Roussin. We're seeing lots of kind of anecdotal evidence on social media of mainly high school students not respecting social distancing, be it, taking a picture together, lining up in front of a fast food place without masks, as though there were no pandemic going on. How much is this a concern for you?
Well, I think the adherence to the fundamentals is a big concern because it's a step away from the restrictions that we had in place in the early days of this. So the idea here is that Manitobans can continue to step up, practice those fundamentals, and we don't need to have the restrictions imposed. We can just live with this virus by following those fundamentals. If we see high levels of transmission, burden on our healthcare system, the transmission like we saw weeks ago in Paramount Health, then we do have to reimpose those restrictions. So it is a concern because it affects us all, and it affects the way we're going to manage this pandemic going forward.
From CHVN, Taylor.
Hi there. So my question today is more about stigmatization regarding children. Now, we know that we talk to kids a little bit differently than we would to adults about this, but how can parents talk to their kids about being kind to their classmates, whether their classmate has a cold or even may have COVID-19?
Yeah, and I think it's important, and as we're going to see cases in schools, I think we have to really be able to pass on that message to our kids, to all Manitobans, that we're all living with this virus. Our actions affect other people, but no one wants to come down with COVID-19, and certainly in this situation, this individual at school did everything correct. everything that we would have asked them to do. And so we have to keep that in mind and be kind to everyone. And I think just speaking openly that this virus is here, but we're all choosing to live with this virus. We're going to keep things moving here despite the virus, but we have a lot of things we can do to protect ourselves and protect the people around us, but we just have to be able to adhere to that.
And with schools reopening and things getting colder in Manitoba and people staying inside more, are you anticipating an increase in demand for tests?
And sorry, increase in?
In testing, demand for testing.
Yeah, well, I mean, this is the thing. We get to respiratory virus season every single year, and so we're going to expect to see those viruses that normally circulate, influenza, RSV, rhinovirus. We're going to start seeing more of that, and the symptoms of this is the same as COVID. We can't distinguish that without a test. So those fundamentals are going to protect us. If we look at other jurisdictions in the southern hemisphere who have a flu season that predates ours, very low flu seasons, and that has to do with the fundamentals that they've been practicing. So yes, we're prepared for more symptomatic people, more testing required, and as we've been saying that businesses, families, individuals have to prepare for high levels of absenteeism because we can't have ill people showing up for work or school.
Thank you, Doctor. Back to room 68 for a few more questions.
Dr. Roussin, what reason did the Churchill High student give public health investigators for going to get a test?
Yeah, this is personal health information, so we don't share that, yeah.
Dr. Roussin, can you say why, apparently there was a case involving a personal care home in Northern Health. Why wasn't that declared an outbreak?
Yeah, this was in a healthcare worker, but they weren't at the site during their infectious period.
Dr. Roussin, we've seen research done here in Manitoba, partly involving Chatham Lab and as well around the world, showing that the virus is mostly shedded a couple of days after patients are symptomatic. And there was some talk of reducing the isolation period from 14 to 10 days. Can you confirm that you are recommending a change to policy here to get the 14 days down to the 10 days?
Yeah, we have changed that. Yeah, so cases, confirmed cases, will only have to self-isolate for 10 days after the onset of symptoms.
Oh, when did that start?
That was many weeks ago.
Was that in the public health information, or?
No, because it only applies to active cases. So active cases are in contact with public health every day. So we'd advise them when they have to self-isolate.
So are recoveries now moved up to 10 days, or is that still 2 weeks?
Yep.
Recoveries, oh, wow.
10 days after the symptoms start.
Onset of symptoms, yeah, not test, onset of symptoms.
On that note, are we going to change the quarantine restricting?
No, so this is a good question. So this is the distinction, right, between the incubation period and the infectious period. So the infectious period is 2 days before the onset of symptoms to 10 days after. The incubation period is 14 days. So contacts of cases still have to isolate for 14 days.
I know a lot of the information about the student is private or personal, but can you say whether they got COVID through travel or close contact or community transmission? Can you kind of specify?
Yeah, I don't have a bunch to share on an individual case. We like to provide the roll-up of how many people get it through close contact and through travel, but we don't like it when it's to discuss the specifics of an individual. So all we know is that the testing was performed while asymptomatic, and there was no public health reason that they were required to self-isolate at the time.
So now family members that live with this child will be isolating as well?
Yeah, right. So household contacts will almost always be cases or contacts to a case.
Dr. Roussin, you've been framing the asymptomatic questions around the asymptomatic individual. Is the concern not more about them spreading to others? Is that not where the sort of health concern would be?
Well, I mean, certainly there can be asymptomatic transmission or pre-symptomatic transmission. So I'm not sure exactly what the question is?
Well, in your example of having gone to work yesterday, been asymptomatic, and then gone today, and
Yeah.
still asymptomatic, and it was no greater risk to you, the asymptomatic individual.
To other people. Right, to
Oh,
other
all
people, right?
thank you,
So,
sorry. It was
yeah,
your
that's,
phrasing sounded like the risk to you was
that's right,
still
yeah.
different.
No, the risk to others, you know, would be the same today as if I went for testing yesterday or if I didn't, if I'm asymptomatic, so, yeah.
I'm sorry, just to follow up, the asymptomatic rate in the province is still 13%, according to the last EPI report?
That's right, it hasn't changed, yeah. By far, our cases have been symptomatic, and then the vast majority of our asymptomatic cases are known contacts who we've tested when they're asymptomatic.
That's how
Yeah.
they were caught.
Yeah.
How they were
Yeah, so
identified.
there's a few, but only a handful of people that we picked up through our surveillance, asymptomatic surveillance. But most of our asymptomatic cases are contacts of known cases.
How many people are in that Sentinel program, ballpark?
Yeah, I don't have a number on that. It was, you know, this was the offering of testing at all, you know, ERs and urgent cares. So most people didn't take us up on that, but we did get a significant amount, yeah.
Are there any minors in the Sentinel testing?
All urgent care and ERs were involved.
You see where I'm going with this? Was a Churchill High student part of the Sentinel program?
Well, I don't want to discuss specifics on the individual.
Would you tell us if they weren't?
I just don't want to, I don't want to provide any specifics on the individual.
Okay.
Good, yeah.